Good evening to all. I'm honored to be here to participate in this wonderful event, and certainly it's one that's very important, and it's important for many, many reasons, but it's important simply because it's about helping to save lives, and not only to create that awareness, but to continue the advocacy and so forth, which is vitally important. You know,
our National Red Dress reception and program is presented by the National Trends and Services Facet, under the leadership of Real Use Resist and Frida Shipman. Would you two please stand? And actually, will all the members of the National Trends and Services Facet please stand? You've all done a great job to pull this program off tonight. Please stand and be recognized.
My name is Nicolette Martin, and I'm a physician, and I'm also a member of the Arlington Links. Tonight, we're going to bring you a very special program from these four lovely ladies. Please try to hold your questions till the end. If you have copies of this, you can maybe jot down your questions, and so as we go through, you won't have any trouble remembering them, and then you can read them off during the question and answer, or you can bring them up.
With the heart. What I'm going to address tonight more than anything else is the predominant heart disease form that you'll see, which is patients who've had heart attacks at work, because that's where we are, trying to prevent heart attacks. Now, the heart is a muscle, just like any other muscle injury. You want to be in a normal range. And if you had any medical problems, for example, anybody in the room who has diabetes or high cholesterol, should be closer to 120 over 80. There's good data to say this protects the kidneys. So long-term, your kidney health will be
Center in DC, and she specializes in women's issues. Dr. Ellis attended Jefferson Medical School and Yale undergrad. She did her fellowship in New York, and she also has an MBA from Johns Hopkins University. She is going to speak to you about treatment options, if you don't listen to Dr. Williams, okay, as well as the racial disparities in our community in terms of health issues and specific.
Nothing from the squeak to the tail that is good about the pit. You might know there is nothing from the squeak to the tail. Other than a football, some leather. I mean, and I used to love my greens with some trotters in there.
Yeah.
And smoked turkey legs.
Is from a very special young lady. Her name is Ms. Olivia Jones. Okay. This lady started out, as Laverne previously mentioned, sort of with a rough, rocky road to life. She was born with a medical condition known as idiopathic dilated cardiomyopathy, which means an enlarged heart. It was so severe that she was on a transplant list for 296 days. She finally did receive her transplant on September 25th, 2005, at the ripe old age of 18 months. And today, as you can see, she is healthy, happy, and is going to be one of our best presenters, Ms. Olivia Jones.
I'm Shawnee Burnett Jones, and this is my daughter, Olivia Grace Jones. As mentioned, Olivia was diagnosed with idiopathic cardiomyopathy when she was 6 months old. She actually wasn't born with it. She got a virus, and they think it was similar to a cold virus. And at 6 months old, she started wheezing and making strange noises. And you know, the third child around, I figured, oh, we can handle this. So we waited a day or two, and the wheezing continued. And so we took her to the hospital, to the emergency room, and the look on the ER doctor's face when he rounded the corner following the x-ray told us very much so that what was wrong was not pneumonia, which is what we thought, but in fact that her heart was too big. It was twice the size that it should have been. So that started our journey.
75 bees. Maybe I'm brave.
Yes, you're right. So Olivia's beads are her beads of courage, and each bead represents.
Oh, it holds the beads.
star of the show. She definitely was.
Put a little salt on your food, which we tell nobody else to do, right? A little salt on your food, and make sure you're eating regularly, and it's usually enough. Thank you. The aspirins have been associated with a decrease in heart attack incidence, decreased cancer incidence for several cancers, and a decrease in Alzheimer's incidence, okay? So most of us take baby aspirins. Whether you have cholesterol problems or not, if you have high blood pressure, if you just want to do something good for your diet, I believe fish oils are really good, and I'll tell you what, they're anti-inflammatory. They're just not for cholesterol, although we use them for cholesterol, they're anti-inflammatory. So on those days when you get upset, there's little teeny things happening in your arteries and little pieces of fat that are starting to accumulate, the anti-inflammatories help to settle that fat process down so those arteries don't get inflamed. So I actually believe they're very good. Now I will tell you this, there's no data for vitamin C and there's no data for vitamin E, and we've had good controlled studies for those, so I'll let you know that. But as far as the fish oils are, they look pretty good. And as far as baby aspirin, I'm telling you, all the cardiologists do it, so I think you'd be in a good group. Your small blood vessels started leaking. And it is something to be careful about. It depends on the dose of it. In most cases, unless you take something, and I don't know what you were taking, but there's something called omeprazole, which is a very, very concentrated form of fish oil. It gives you a lot of fish oils. And if you take an aspirin with that, that's probably almost as something.
We're just thrilled to see this many people here committed to living well. You should be very glad that you've made this decision, and we're going to try to help you maintain that decision. We have a number of events coming up, and we'll talk to you about those. But I just wanted to say that it's a pleasure to host you tonight. It's a pleasure to bring you the opportunity to hear this wonderful information, to be able to ask. And we're just delighted that you came, Olivia. We want to tell you, Olivia's mom, Ms. Jones, we have so much, just words can't express the gift you gave us tonight, how you talked so movingly about your experience. And what we understand is that when you said that you're just going to say, God makes rainbows. And so all of us out here with any kind of challenge, God makes rainbows. And we're just grateful you brought that message to us this evening. Thank you so much.